This week I had a patient come see me today who has a history of having 5 separate knee surgeries and was told by her surgeon that there was nothing wrong and that the pain was essentially coming from inside of her head. Now, the patient obviously was very upset by this, but I'm here to talk to you about this phenomenon and say that that actually is partially true. And here's why anxiety can result from chronic pain. So in the past, we've talked about the fact that pain signals, when they're transmitted over and over and over again, can become hypersensitized and can become automatic and fire when they shouldn't and fire at a lower threshold and fire continuously. Well, if you think about any time you hurt yourself, let's say you stub your toe, obviously when you stub your toe, you don't have a non-emotional reaction to that. You have a very emotional reaction to that. You feel angry, you're pissed off, and that's very classic with what happens when you get hurt. Now think about if you had chronic pain and you had this getting stimulated over and over and over again to your central nervous system. Well, obviously the emotional component of that pain experience is being transmitted just as often as the pain signal is. So what happens is people actually do develop an anxiety disorder over time from the chronic pain. So it's a very real phenomenon. So when people feel chronic pain and they have anxiety, it's not that they're making it up, it's a result of being in that state and having that painful signal sent over and over and over again. And the patient actually felt a sense of relief in that she didn't necessarily feel she was crazy, but that now she kind of had a more solid understanding of what the role of anxiety was in her pain. And that a key component in treating her going forward is realizing that this pain is real, but there's not a surgical solution to it, and that the anxiety she feels from this is an actual real result of her chronic pain, and she can approach it in a more objective way. So hopefully you can find this information helpful for you if you're dealing with chronic pain, and that anxiety and depression is a direct result of this, and that if you can approach it from an objective standpoint, that is going to be a very useful tool in you dealing with this chronic pain. So if someone says it's in your head, it's partially true, but it's not that you're making it up, and here's a tool for you to take forward and hopefully get better results. Thank you.